Forward progress in reopening our society and our economy is not always inevitable. It is dependent and will remain dependent on the threat of the disease. We don't have a vaccine and we don't have an effective treatment for Covid-19. But having said that, we're not powerless. We have now learned how to protect ourselves and others in this country from this disease. And we will make progress only if we continue, day in and day out, to practice and do what we know works. If we wash our hands, cover our coughs and our sneezes, respect the 2-metre rule, and it is 2 metres, we will make progress. If we keep the number and the duration of our contacts low and we stay away from crowds, we will make progress. And just to dwell on that point, we've seen now that in terms of new cases of COVID, in figures published by the HPSC, about 59% from memory of new cases are coming from close contacts. So we know as we begin to move about and develop more close contacts and increase the number of close contacts, that does increase the risk of the virus spreading. So we do need to make a very conscious effort, regardless of what restrictions may say or what public health rules may be. There is an individual responsibility on all of us to try and keep the number of our close contacts low to slow down the spread of this virus. If we keep ourselves informed of the symptoms of Covid-19, and if we develop those symptoms, if we put ourselves forward for testing, and as we await that testing, if we self-isolate, we will continue to make progress. If we practice what we've learned and continue to show consideration for each other, particularly for groups most at risk, we will make progress. And we are making progress, because figures from the Health Protection Surveillance Centre show that as of midnight on the 30th of May, 110 outbreaks in residential care facilities have been closed. That's 110 residential care facilities that had an outbreak of Covid-19 that have now been Covid-free for 28 days or more. Of these, 61 are nursing homes. That figure was just 29 last week. So a very significant increase in a week in the number of nursing homes that are now being able to say they're Covid-free after having a Covid outbreak. It's 32 nursing homes in our country that had Covid, that now haven't had any Covid in over 28 days. And I want to pay tribute to the staff in those nursing homes, to the nursing home owners, and to the local health service for the collective work to make that progress. It does show great progress across our long-term residential facilities, which have been the front line in the battle against this virus. I also know this will come as a huge relief to families across the country who have been apart from their loved ones for almost 3 months now, haven't been able to visit maybe a mum or dad or a granny or granddad or an aunt or an uncle or a brother or sister in a nursing home. And I hope that government will be in a position tomorrow to maybe consider some issues in relation to trying to ease visitor restrictions in a way that is safe. On the issue of non-COVID care, I wish to advise the Dáil that I met with the CEO of the National Screening Service this morning. I do appreciate that the resumption of screening, or the need to resume screening, is causing real anxiety for people in this country, and particularly for women in this country when we consider cervical check and breast check. I want to assure this House and the people who use our screening services that a plan for the resumption of services is underway. There's extensive work ongoing, and I do expect real progress shortly. I've asked that our screening service liaise and meet with, be it virtually or otherwise, meet with the advocacy groups in this regard, meet with the 221 Plus group, meet with the Cancer Society, meet with the Mary Keating Foundation and others. But I also want you to know our screening service is working incredibly hard, and I was left in absolutely no doubt from that. The clinicians leading these programmes are working really hard, and they're not just waiting. So, for example, already Cervical Check has carried out trials of the new HPV test, where it invited women to come forward through both the Irish Family Planning Association and the Well Woman Clinic to see how our new HPV test is working. Breast Check is currently working with infection control specialists to modify their mobile units. I think we've 20 mobile units around the country. We need to change pretty radically how people go in and out of those facilities. Extensive work has been carried out in that regard, and also in relation to bowel screen and the diabetic retina screening. There's a huge amount of work being done here. It would be wrong of anyone in this House, because no clinician can do this, to promise a return to screening as normal. Screening will have to change, and we will all have to prepare for that change. It will have to be done in a way that is safe and effective. But we will work with clinicians, we'll work with staff to ensure they're protected in their duties, that women and indeed men have the confidence to come forward for our screenings as well, and to work with service users to ensure that they are protected in trying to provide these services in a COVID world. We must and we will get this right, and it will be safe. And I expect the National Screening Service, whom I hope members in this House will have an opportunity to engage with as well, to be able to update in concrete terms as to how they intend to resume each of the 4 screening programmes, and that they'd be able to provide much more detail in that regard during the month of June. As we open more of our economy and society, and I do hope that tomorrow government will be able to recommend and proceed with phase 2 from Monday, our individual actions will matter more than ever. The government can and will take appropriate measures. The health service can and will take appropriate measures. It will prepare for every eventuality. But we will need you more than ever, because the best line of defence, the first line of defence, is all of us as individuals, the people of Ireland, following the advice, continuing to wash hands, continuing to practice social distancing, continuing to keep their number of close contacts to a minimum. This is the best chance we have of success. So let's do it for each other, let's work together, and let's protect each other, and in doing so, I'm confident we can move forward and not backwards when it comes to our roadmap. Gurmagat.
Thank you, Minister. We now move to Fianna Fáil, who have 15 minutes, and they have 5 speakers lined up to share the 15 minutes.
I'm going to take the first 5, Chair.
You're taking the first 5, and after that,
2.5 each.
The Minister will reply to everybody at once, or do you want? Is there?
I think everyone would prefer to do their own, slot, if we could, and we might rely on your laser-like focus to make sure everybody gets their time.
In hopefully a positive direction.
Thank you, Chair. Minister, I'd like to ask you about 2 different areas. One, the screening services, and thank you for the update, and the second is the contract with the private hospitals. On the screening services, obviously they had to be closed down. We screen about 3,000 women and men a day. So closing them for 3 months has meant that 170,000 screenings thereabouts haven't happened, and we all back the screening services. We know early detection saves lives, and unfortunately also therefore delayed detection can cost lives. Many doctors, Minister, believe that they can open now. Cervical screening, for example, in the 3 months that have passed, 70,000 women will not have been screened. GPs and scientists are contacting me and saying the GPs are ready, social distancing measures are in place, they can take tests now. The labs are saying that they can do the tests now. The colposcopists, the specialists are there saying we can take the referrals from the lab results now. So I'd like to ask you when we're going to have a date, because doctors are really anxious about this. I'll just read you out what one GP said to me this week. Quote, "We have a tentative date for opening of hairdressers and pubs, but not for cancer screening. It's alarming and extremely concerning." So I welcome your update today. I welcome that you're engaging with the screening services, but what the clinicians are asking for is a date. When are we going to have a date when they can get back to providing this life-saving service? The second question, Minister, is about the contract with the private hospitals. As you know, I was fully in favour of the initial decision, but not of the ongoing use of it. I don't think it worked well, and I welcome the decision to end the contract, and hopefully we will have some replacement capacity put in place for public patients, obviously. But I don't understand why it's being run through June. We're still going to pay over €115 million. The reduced capacity that is the result of this effort to try and do both at the same time, my understanding is will result in about 10,000 less surgeries happening under general anaesthetic, so serious surgery for public and private patients. It was also revealed at committee that no effort was made to ask the private hospitals if they would consider ending the contract sooner. So can I ask you, Minister, why was no effort made to end it sooner so that we could try and get patients the care they needed quicker? Thank you.
Thanks.
Next is
he's going to. Sorry, Chair. We'll do the 5 minutes with me, if that's okay. Thank you.
So I'll stop at 10 minutes. Thanks to Deputy Donnelly. So just firstly, I mean, I want to be in a position to be really clear about. I want to be really clear about this. I want to be in a position. The Department of Health wants to be in a position. The HSE wants to be in a position. This Oireachtas wants to be in a position to recommence our population screening programmes as soon as possible. It's a collective priority for all of us. I am glad to inform you that the 4 programmes, there are obviously 4 parts to our screening service, will report on their final plans for restarting in the coming days. Had a very good meeting with the HSE CEO and Chief Clinical Officer Dr Colm Henry yesterday, I believe. A very good meeting today with the Chief Executive of the National Screening Service as well. But I do have to emphasise, and I know you don't mean it like this, Deputy Donnelly, but when people say, you know, this can open and that can open, there is a complexity in relation to getting our screening services right. It has to be safe for patients, we know that. It has to be safe for staff, and it also has to have the confidence of people that they'll begin to come forward. Again, remember, this is often healthy people volunteering to come forward into our health service. Screening can often involve tests or examinations, which can present challenges for staff running these programmes in light of the need to comply with physical distancing measures. So there is a working group established. It's chaired by Dr. Caroline Mason, and I want to thank her for the work. So it is being led by a clinician, and it is reporting to the Chief Clinical Officer, Dr. Colm Henry. The working group is reviewing the individual programme plans for recommencement and developing a framework to support the safe restart of all 4 programmes. And just on the issue of, if you take cervical check, the example you gave me, there's kind of 3 parts to it. There's the sample takers, largely GPs and nurses. I accept that they're probably in a good place to go. There's making sure we have, from a colposcopy point of view, treatment pathways. And then there's the labs. And we just need to make sure each of those 3 parts are lined up so we can have a seamless recommencement. On the issue of private hospitals, I want to make sure that we use the time left to the end of this month to have a successor arrangement. I did explain in this House last week that there are already a number of services that have transferred nearly wholly from the public health service to the private health service, particularly in the space of cancer care, and I listed them last week. I want to make sure that we use that time available so that there isn't a cliff edge, so that we don't just have no agreement or a vacuum, and that's why we took the decision to use the period of time between now and the end of June to negotiate what I think will be a better and more fit-for-purpose deal.
Thank you, Minister. Now, Deputy Butler.
Minister, I also want to revisit the issue in relation to cancer screening services. And I just want to put the point across from a woman's point of view. Women are worried, and many, many women, and I would encourage everyone to avail of this screening when it's available to you. When you turn 50, you get a letter in relation to breast check. It's the first time you get it, and you are invited to avail of a breast check service. I know a lady that availed of that breast check service 2 years ago, and unfortunately she was diagnosed with cancer, but she had a great outcome because it was found so early. Also in relation to smear tests and cervical check, it is so very important for women's health. And genuinely, women are phoning me on a regular basis, and I'm sure they are contacting lots of people, that they are genuinely concerned. Now, I acknowledge your answer there, but I think it is very, very important that we do get clarity. We need to reopen cancer services as quickly as cancer screening services as quickly as possible. And I understand the obvious health and safety challenges posed by the pandemic. So, in light of the answer you have given already, can I ask you, Minister, can you clarify whether people who received tests prior to the suspension of cancer screening services, which would have happened, I suppose, in March and April, have they been receiving results in the interim period? I know our laboratories have been under pressure due to the pandemic, but surely administering results of those who received tests prior to the suspension should be the first step. We all know the earlier you catch cancer, the easier it is to treat. But if people don't get their diagnosis, they can in turn be in serious trouble down the line. Gorv Mahagut.
Deputy Brendan Smith.
Thank you very much, Cathaoirligh. I wish again to emphasise my very strong belief that we need to address the Covid-19 pandemic issues to the greatest possible extent on an all-Ireland basis. Having a memorandum of understanding between the health departments, north and south, is welcome and essential and needs to be built upon. Perhaps we need more measures to be implemented at sectoral level through the North-South Ministerial Council and give out a clear message of the value and importance of the all-Ireland approach across different areas of our daily lives. The gradual reopening of the economy north and south, which we all will welcome, will entail more movement of persons, goods and services with attendant risks. In border areas such as Cavan Monaghan, my own constituency, the people there need to be assured of the similarity of approaches and the implementation of strong measures, north and south, to deal with this pandemic for the benefit of all on this island. That message could help to emphasise the continued need for a prudent and diligent approach. I raised previously the need for a compatible app system for tracing purposes north and south between our HSE and the NHS. For some weeks, Cavan, unfortunately, has recorded the highest incidence of COVID per head of population, and Monaghan the third highest. That has been a trend since the third week of April and continues presently. There is a considerable difference in the incident rates between my constituency and the two counties with the lowest rates, namely Waterford and Wexford. An investigation, I believe, and I called for it through parliamentary questions, Minister, and in other debates, an investigation should be carried out by public health officials to determine the reasons for the rates of virus occurring in the Cavan Monaghan area. If particular deficiencies are identified in healthcare provision in this area, then I would appeal to the Minister to ensure that the necessary resources are provided to the public and private healthcare providers to address such deficiencies. I appreciate the good reasons for the cancellation of routine hospital work at the onset of this pandemic. With more speed now, we need to see both public and private hospital capacity being put to much greater use, as referred to by both of my colleagues, Deputies Donnelly and Butler. I spoke to clinicians, Minister, who are very concerned that they have been unable to attend to patients who need assessments or treatment. They believe very strongly that the balance between increasing very substantially hospital capacity and retaining a necessary complement of beds for COVID patients can be balanced. And again, I welcome your reference to the cancer screening services, but we need a time frame for all of those services being restored. Thank you, Cancorda.
Sorry, if the Minister could answer me those questions to the last two speakers.
There don't need any questions. Go ahead.
Shall I answer your colleagues first? Yeah, thanks very much. So, Deputy Butler, I might write you with a little bit more detail on screening so as not to use up your colleagues' time, but I know how important this issue is. I know how many times you've raised it. I do want to just say the National Screening Service is holding daily meetings in relation to this. I am very satisfied with the work being done by Dr. Caroline Mason-Mohan. Dr. Mason-Mohan is the Interim Director of Cervical Check. She is a public health doctor as well. She is leading the working group on it. I think it's appropriate that this is led by clinicians. I do think, though, that they need to link in with the advocacy groups and inform them as well, and I'm hopeful we'll have more news on that very shortly. Deputy Smith, I fully...
Communicate with me in writing.
Is that okay? Yeah, I'll communicate with you in writing as well. But I agree with you in
colleagues.
relation to the importance of cross-border, and I can send you details on what we're doing, and also in relation to Cavan and Monaghan and the statistics. I'll write to you in that regard.
Please.
Yeah. Thank you, Ceann Comhairle. Minister, can I ask just a number of questions? Firstly, can you confirm whether or not the refresh revision for change will be brought to Cabinet this week for the purposes of publication? Secondly, has there been any progress on establishing a cross-departmental task force on mental health, which I think is going to be very badly needed? And I think thirdly, can you give clarity on physiotherapy? I've had a number of requests from physiotherapists and neuromuscular physiotherapy and similar professions who seem to have a lack of clarity as to when they will be open. And fourthly, then it would appear, and a similar question in relation to screening programmes, it would appear that at the end of the month all non-essential retail and so on services can reopen. That would appear to include sunbed facilities. Now, I think it would be something, quite grating for the public if you could get a sunbed at the end of the month, but you're not going to be able to get your cancer screening. Thank you.
Maybe Deputy Smith, would you come in and we'll take an answer then? Maybe.
Minister, I'd like to obviously echo the calls of my colleagues here on screening, but also to add to that in terms of the turnaround time for the results to come back, we have heard stories of women having to wait possibly weeks and weeks and months possibly on end without any, I suppose, clarification on their tests, and I think that would be important when we're talking about screening. However, speaking today, I want to remember firstly all those who have lost their lives to Covid-19 and the terrible impact that is having on family and friends. Not being able to spend the last hours with their loved one, not being able to say goodbye to their loved one, and the deep sense of grief that those who have not being able to celebrate the lives and the usual funeral ritual that is so important to the grieving process here in Ireland. Covid-19 has had a devastating impact on hundreds of families, not least of my own constituency of Cavan Monaghan, as you've just heard, Minister. And as I'm sure you're very well aware, the Cavan and Monaghan unfortunately have had the highest number of cases in the country. Cavan at the moment standing at 844 cases and Monaghan at 515. So, Minister, I have a couple of questions and I'd like you to take time to respond to those at the end. What has been the reason identified for that? We've seen mappings done of Ireland where Cavan really stands out on its own, head and shoulders above anybody else, for the very high number of confirmed cases. What has you and your government and your department done to support Cavan General Hospital, who is at the front line firefighting these cases, and also in Monaghan Hospital as well? How are you assisting them in dealing with this high number of cases? Where are the clusters occurring and possibly reoccurring? Is it the meat factories? Is it family clusters? We heard Dr. Iona Duffy speak about this yesterday, and there's questions over that, but I'm sure you and your department and your team may possibly have identified that. And what are your department doing to suppress the spread Are there extra resources being put in place for testing and tracing to stop the spread? And I'd like to hear a response on that, Minister.
Okay, thank you, Deputy Minister.
So I'll answer as many as I can in the time available and write to the deputies and the other two. In relation to Deputy Brown's question about the Vision for Change, I've heard very clearly the calls on a cross-party basis in this House for the publication of the refresh Vision for Change, and it is my intention to bring it to Cabinet this week, hopefully this evening, with a view to briefing the advocacy groups, or my colleague Minister Daly briefing the advocacy groups probably early next week and publishing the document next week. So approve it by government this week, publish it next week. It will be a matter for the new government to obviously implement it, but I think it makes sense, and I think colleagues in this House persuaded me of that as well. The cross-departmental piece, I think, feeds into that, because I know when talking to mental health reform and others, I think it's very important whatever structure we put in place links in with Vision for Change as well. Deputy Smith, I note your comments in relation to screening. I'll write to you as I've outlined in relation to that. I also note your comments in relation to funerals, and I hope as we move to phase 2, or hope we move to phase 2 next week, we might be able to look and see is there something we can do to maybe increase, and even in a slight way, the number of people who can attend funerals. Deputy Kelly raised this here last week as well. In relation to Cavan General Hospital, I'd suggest I'll send you a note in relation to that and the statistics for Cavan and Monaghan. I think there's a number of reasons, as opposed to any one, why a county can see spikes at certain times, and I'll write to you on both of them this week.
Thank you, Minister. We move now to Deputy Louise O'Reilly, sharing with Kildare Deputies Cronin and Ryan.
That's right, Count Corla 7, 4 and 4. So if I can do 4 and 3, as I have done previously, if that's okay with the Minister, and then I want to obviously protect the time for the other deputies. Minister, I got a PQ from your department last night, which advises me that the bed capacity in the public and voluntary system, not including private beds, has increased to 11,907. So this means that because of Covid-19, we've been able to increase the capacity in our public hospitals by 1,407 beds, compared to the bed capacity review said we had in 2018. So that's an increase of just over 1,400. Minister, you'll know, because I've been saying it to you for a long time, that along with the health unions like the INMO, the IMO, SIPTU, the IHCA, Enforsa and others, we've been calling for all closed beds in our hospital to be opened. It's really frightening to think that when we had more than 700 patients on trolleys in our hospitals, that over 1,000 beds remained closed purely and simply because you wouldn't tackle the recruitment and retention crisis and ensure that we could get the necessary staff to be able to open those beds. It beggars belief when you consider that, very often, I mean, it didn't even make the news. It's hard to, to conceive of it now, but when you talk about waiting lists, a little bit like, what do they say, it's like deja vu all over again. It hardly even made the news if it was, unless it was close to 700 or over 700. But actually that was very, very much a daily occurrence. And now we find that the beds in the system did exist. What they needed simply was staff. Minister, I'm looking for a breakdown of where these additional beds are by hospital, and I take that in writing if you can. And I want a commitment from you that as we exit the Covid-19 crisis, that you will ensure that every single hospital bed that has been opened in the public system will remain opened, because it will be absolutely needed. Minister, I'm looking for an update from you also as to how many beds will be temporarily set aside in the public hospital network to take account of the additional infection control measures, because informally I'm being told that this could take up to 25% of the beds out of the acute hospital system, and that is deeply, deeply worrying. So in order to be cognizant of infection control measures, can you give me an update on this? Is the figure of up to a quarter accurate? And can you confirm, Minister, that as these beds start to be reopened, and some will, that they will be reopened in accordance with the safe staffing level agreement that was agreed with the INMO. It's just over a year ago that nurses and midwives from the INMO were on the picket line for safe staffing. There's an existing agreement. It has set the benchmark in terms of what is safe, and I suppose I and others are seeking confirmation from you that you will adhere to that agreement. I'm also looking for an update, Minister, in relation to the restarting of care. So I appreciate what you've said with regard to screening. It's an issue that I've raised on many occasions here with you, and I welcome the confirmation. However, what we need to see are dates,
firm timeframes, and also a commitment that the missed care will be caught up on. So, can you confirm that there's going to be a twin-track approach to this? Is there going to be a catch-up programme? And is there going to be, most importantly, an information programme for women? Because, a lot of us will be nervous and anxious going back to the screening service. We know how important it is. We've spoken at length about it. But I want to be able to say with confidence, and I want to have that confidence myself, Minister, as a user of the service, but I want to be able to say with others with confidence that they can go back, and they need that information campaign. It's absolutely imperative. And very, very finally, can I ask, just with regard to restaurants opening up in June, can you confirm that pubs with restaurant licences are going to be able to open at the same time? And anyone who's as old as I am will remember in the late 80s and early 90s when you had to get a bag of chips or a plate of manky curry just for the venue to be able to continue to serve, showing your age there, Deputy Kelly, for the venue to be able to continue to serve alcohol. Is this going to be the case? Are the two going to be linked? Thank you.
Minister. You never ate the mushy peas in those places.
I don't think we
Chicken in a basket.
I don't think we ever did that in Greystones at any stage. We'd have to ask Deputy Donnelly. He's a little bit older than me, but look, thanks Deputy O'Reilly for the questions. Firstly, I had a really good meeting with both the INMO and with SIP2 Health on someday this week, and I'm due to meet both of them again next week. It was Monday, I'm due to meet both of them again next week. And one of the issues we've started discussing with them is kind of the issues you're discussing in relation to how do we prepare to provide non-COVID care, prepare for winter, prepare knowing that this is going to be with us, and a lot of those issues that you raised are issues they've started discussing with me. I'll get you a breakdown of those extra beds, no problem. I'll send that to you in writing. I mean, you're asking me the question, will I give a guarantee that the beds will remain open? If I'm the Minister, that's certainly my intention. I'm conscious of the fact that at some point this House is probably going to elect a new government, and these will obviously be matters for the new government. But there's no doubt we're going to need all the extra capacity that we've opened, and we're going to need more. And I suppose the conversation that I had with the unions, though they didn't need me to explain this, and they know what they're on the front line, it's going to be about more than that too, as you know. It's going to be about new models of care. It's actually going to be about all the things we talk about every year, but we're really going to have to actually do, which in terms of moving care out of the hospitals. And keeping as many people as possible, whether that's older people who end up in hospital every winter, trying to look at how you interrupt that flow, whether it's some of the outpatients that can be done. There's a big body of work that's going to need to be done in that regard. Yes, the state staffing levels will have to be adhered to. Your figure of 20, I used the figure of about 20%, but yes, up to a quarter of beds is a real possibility in terms of infection control, but this is something that the CEO of the HSE is kind of bottoming out at the moment. We discussed it only this week. In relation to the issue of non-COVID care, and I acknowledge the many times you've raised screening with me, I just want to be careful. I don't intend to give any commitment on the floor of this stall in terms of how the programme will be resumed, because I think that has to be clinician-led. In the past, maybe I've given commitments that people have been critical of in relation to screening. I'm not going to do that again. It has to be clinician-led. But your point about the need for an information programme for women and indeed for men who use some of the screening programmes is vital. I'd like to see the Irish Cancer Society, the 221 Plus group, the Mary Keating Foundation invited in to meet the screening service. I know many of them are in contact, and I've asked that happens. On the issue of pubs and restaurants, I just can't get ahead of the government decision-making process in that regard. This is something that we'll obviously have to consider as we get to the further phases. So I'll have to revert back to you on the curry and mushy peas, Cian Corla, but I'll write to you on that matter, Deputy.
Thank you, Minister. Deputy Cronin.
Cian Corla. To date, we have had over 1,000 people killed by COVID in our nursing homes across the state, at least according to HSE figures. Over 112 of these in my own constituency in Kildare North, where we paid a remarkably heavy price. We saw at the COVID committee last week the HSE and the Department of Health, and indeed this Minister, had no proper plan for our protection in place for nursing homes. No plan, despite knowing our elderly were at particular risk, despite having the advance warning from Italy, and despite healthcare workers begging for PPE. In their own homes, our elderly could cocoon, but if they were living in nursing homes, they had to take their chances with the virus. This is a devastating inequality. Those who died without their hands held by their loved ones, the families grieving without the comfort of a traditional Irish funeral, and the healthcare workers who risked their own lives to protect these dying patients without adequate PPE. Minister, you are right to seek additional acute hospitals beds. I would have done the same. But you were wrong to relegate the nursing homes to an inferior position. Wrong to allow age put a discount on people's lives. The department was careless. Careless, according to HSE figures, so much so that the equivalent of 3 jumbo jets crashed across our country. If these planes had actually crashed, we would have had days of national mourning. But luckily, so far, there has been hardly a murmur. And the story in the HSE, the story in the Irish Times this morning about HSE figures, it makes it even more important to have an independent investigation. It must be an independent investigation because with the regulation, the loss of lives, we cannot have the HSE and the Department of Health investigating themselves. Because these tragic deaths, they were not inevitable. In Kildare North and across the state, people want to know the hows, the whys and the whos. Not for blame, because blame is just finger pointing, but for accountability. Accountability makes us hold up our hands and take responsibility and learn. History shows us that we need that from the HSE and the Department of Health. Last April, I asked you to publish the Fair Deal Private Nursing Homes Private Mechanism Review. Despite a reminder, I'm still waiting for a reply, Minister. We should have this to establish whether homes deemed unviable in that report had a correlation to the clusters of COVID thus far. If there was a correlation, I asked the Minister to take these private nursing homes into public ownership. Care of the older people should not be commodified, privatised or monetised. So I ask the Minister if you will establish an independent investigation into the deaths of nursing homes, and if you agree that in the case of a correlation between these figures, that these nursing homes will be taken into public ownership, and that would be a first step towards the one-tier health system that would befit a real republic.
Minister.
Well, thanks very much. I want to thank the Deputy. I'm not sure the Deputy wants an independent investigation, though, because you seem to have delivered the verdict already, which I think is rather disappointing. To endeavour to say there was no proper plan, nobody did anything. That's not the reality of what I've seen as Minister. What I've seen is the most incredibly dedicated people in the HSE at local level, in the Department of Health, working 24/7 against a global pandemic. And as I said in this House last week, the villain here isn't someone working in the HSE or some bureaucrat or even a minister. The villain here is a virus, the worst that we've seen in a century, that has taken the lives of so many people. Particularly older people. I think 90% of people in this country who've died have had an underlying health condition. We know how infectious this virus is. We know how hard it is to keep out of anybody's home. But I do agree with the Deputy in relation to a number of points. So I do agree with the Deputy in relation to the learnings in terms of the model of care. And I'll revert to the Deputy in relation to the rest.
Deputy Ryan.
Minister, I wish to speak to you regarding the length of waiting lists for child and adolescent mental health services in County Kildare, where I come from. This is more important now than ever. It's always been important, but particularly now. There's an ongoing crisis in CAMHS. The waiting list comes up every year. You and your predecessors wring your hands and promise that things are improving, but all the evidence is showing us that they're not. There is a recruitment crisis, ongoing delays, and children are being turned away from the service because their symptoms don't match the severity that the service is struggling to cope with. Children continue to be admitted to adult services, and there is no 24/7 service. This is even more shocking in the context of the 17.4 billion and rising health budget. I spoke to a father during the week who told me it would have been better if his son had presented with cancer, because at the very least there would have been a swift diagnosis and a clear path to care. This is a shocking indictment of the reality of mental health services for young people. I also spoke with a mother, and she sleeps in her teenage daughter's room. She sleeps there because of fear. She sleeps there because she feels if she doesn't sleep there, that daughter will take her own life. These people are being left behind by a system that is broken, a system that can barely deal with the most serious cases and certainly can't stop the rising tide of cases that, because of neglect, become serious cases much more quickly. Also, Minister, many people with mental health issues are trapped in a vicious circle, a circle which sees them being discharged from the system as quickly as possible with a handful of tablets. Inevitably, they return in a worse state, and we need a lifelong approach to ensure that their health is maintained. Health is about mental health. It's also about keeping that maintained. I would urge you, Minister, to start taking this crisis seriously. Urgent action is needed to address the situation. We need and I really feel this is very important. We need full implementation of a vision for change. We need fully staffed CAMHS teams. We need investment into mental health primary care and a school curriculum for positive mental health. We also need these changes to begin today. We don't need more reports. We don't need more meetings and passing the buck. We need this to be looked at now. Sadly, the delay in addressing this crisis is costing lives, and this needs to stop now, Minister. Thank you.
Minister, just respond.
I want to thank the Deputy for raising the very important issue of mental health, and particularly youth mental health. And we are going to, this week at Government, consider Vision for Change, the new document that the Deputy refers to. A lot of really good work has gone in by a lot of really expert people in this regard, and I hope, subject to Government approval, to be in a position to publish that next week. I know that's something you and your colleagues have been looking for as well, and have written to me in that regard. I do want you to know I take this crisis extremely seriously. And I think this pandemic will have had a real and lasting impact on the mental health of all people in this country, particularly younger people. I won't go through all the funding allocations in the time available to me, but I will write to you on that. But I do agree with you, though, about the need to try and provide more of this in primary care. We have introduced a new grade in assistant psychology post within the HSE. We've seen very significant and positive impacts in relation to that. We had seen before this pandemic the CAMHS waiting lists fall. We do need to see more progress in relation to that, and I'll write to the Deputy this week on more measures intended to take.
Thank you, Minister. Deputy Alan Dillon, sharing with Deputy Fian, I think.
I commend Minister Harris, his officials, and in particular our healthcare and frontline workers for their unwavering commitment to those they treat. I am conscious Ireland's response to Covid-19 has been a momentous effort, one that has brought many communities together, even while physically remaining apart. Everyone I meet acknowledges Ireland's swift response to the crisis is in comparison to other countries which are experiencing greater difficulties. Minister, the mental health crisis triggered by Covid-19 is escalating rapidly. Flattening the mental health curve is the next big coronavirus challenge. While all population groups are affected, this crisis is especially difficult for students, particularly those pushed off a college campus and now facing economic uncertainty. We have youths suffering unemployment, adults with children at home struggling to juggle work and homeschooling, our elderly suffering with cocooning and physical distancing, and our frontline staff and healthcare workers risking their lives to save others. With the concerted effort, clinicians and policymakers must meet this challenge head-on, ensuring waiting lists are reduced and access to services are prioritised. Can I ask the Minister how he intends to flatten the rising mental health curve? I do welcome him bringing the Vision for Change to Cabinet this week. We do need to ensure that our HSE statutory services such as CAMHS, community psychology, adult mental health and the community service groups like in my own constituency, Mindspace, Mayo Mental Health and the various family resource centres are given direction. I also want to mention, Minister, you may recall visiting Mayo University Hospital in November 2016 and witness firsthand the excellent work being done by the hard-working staff. Thankfully, as of Wednesday, I note no new suspected Covid-19 cases have been admitted to Mayo University Hospital for a 5th consecutive day. I am aware of some physical changes to the hospital, including a new entrance. However, having spoken with some local health workers, I wish to point out that concern remains about staff working within Covid and non-Covid patient pathways. Any information available from you or the Sailshire Hospital Group would be greatly appreciated. Therefore, I'd like to ask the Minister if there is any plans to update Sláinte Care in future to include greater provision for isolation rooms and facilities to counter infectious diseases, in addition with increasing bed capacity and further capital investment. Thank you.
Deputy Dillon, Minister.
Mindspace with them in Mayo as well, and I know they've written to me a few times and kept in touch with me, and I'm very taken by the work that they do there. I think the Deputy is right to highlight the issue of mental health as one of the next huge challenges coming down the track in Ceann Comhairle, and I've been in correspondence in this regard as well. I think there's going to be a big body of work that this House collectively, whoever's in government, whoever's in opposition, all of us are going to be duty bound to do in terms of how we deal with the mental health fallout, quite frankly, of this pandemic. We know we faced many challenges in relation to mental health before COVID. We know that's going to be compounded as a result of COVID. I think the first step, and indeed all of you on all sides of the House told me that one of the first steps should be the publication of a new vision for change. That will then mean that the new government won't have to spend months and months deciding whether to publish or amend or review or think about it again. It'll be out there. Its focus then can be on the implementation. This House's focus then can be on overseeing that implementation, and then there'll be no excuse for a programme for government not to properly address this as well, whoever wishes to form one. So Deputy Dillon, I'll keep in touch with you in relation to that. Regarding Mayo University Hospital, just to commend the staff there for the really good work that they're doing. In the interest of time, I'll write to the Deputy on some of the work being done to ensure separate pathways of care for COVID and non-COVID patients in that hospital, but I'm delighted to hear that there's 5 consecutive days where there's been no new COVID case. And the Deputy is entirely correct. The issue of isolation has always been a challenge in the Irish Health Service. It's only going to become a bigger one now. And the Sláinte Care Office in my department and the HSE Board are both looking at the Sláinte Care, what's ahead of schedule, what's behind schedule as a result of the pandemic, and where do we now stand. So a new government will have the benefit of that work when it takes office too.
Thank you, Herlick, and like the Minister, I also would like to express my sympathy to the family and friends of those who have been lost to this disease, and my thoughts are with all those who have been bereaved. And I just want to thank again the frontline staff, all the frontline staff, and maybe one frontline staff I want to thank are the Gardaí. Last night I was driving home to Sligo. I was stopped by the Gardaí at Castle Baldwin last night, and they asked me where I was coming from and where I was going to. And as a citizen of this country whose grandfather was one of the first guards in the Garda Síochána, I want to put on the record here again to thank the Gardaí for helping dissipate this threat against our country and against our citizens. And it's not the first time that the brave men of Garda Síochána, men and women of Garda Síochána, have stood up and defended this country since the foundation of the state, defended the people and the institutions of this country against other threats. And I want to put this on the record, how proud I am of the men and women of Garda Síochána, past and present. And I've said this in this place, and sometimes we don't say it loud enough. And they were courteous, they were inquisitive, but they were very, very professional. And again, I want to thank them. Minister, 2 issues. One, if staff go away on holidays and they are supposed to self-isolate, are the employers responsible to oversee that their staff, if it's in education or hospitals or public service, is there an obligation on the employees, or is there any mechanism in place? Secondly, Minister, a curveball here maybe. The High Court ruling that Gemma O'Doherty and John Waters must pay the High Court cost against the failed attempt to challenge the laws introduced by a caretaker government is a 5-figure sum. What are your views on that, or maybe do you have any views? And finally, I just see over the years we've had people have been applauding and criticising the Swedish approach. You know, they have a softer approach towards curbing the spread of COVID-19, and I just they didn't impose a strict lockdown, and there's for and against that. And do you have any views on the Swedish approach to the COVID-19 issue?
Before the Minister comes in relation to the court case you've alluded to, there is the prospect of a possible appeal in that case, and I think it would be unwise to make any comment at this stage, Minister.
Yeah, I'll respect your view on that, Cian Corla, absolutely. And just to join with Deputy Fee in thanking our frontline staff in the health service, as we do rightly every week, and I've had really good engagement with the unions representing a number of those workers this week, and I also intend to meet with the GP representative body, the IMO, next week as well, and we need to continue to keep that spirit of partnership going. But I think you're absolutely right to thank the Gardaí. As Health Minister, I want to thank them as well, because not only have they done their job as Gardaí in terms of enforcing the law and the regulations, and I thank them for that, most importantly from my perspective, they've been incredible when it comes to community policing, checking in on older people, going to the shops, doing the messages. I mean, real, really, really helpful lookouts, if you like, for vulnerable people in our community. So I join with you in that regard. In relation to the issue of self-isolation, so self-isolation is a public health measure and public health advice. So in the first instance, obviously, your responsibility is on you as a citizen. If you develop a symptom now, you should self-isolate. You should ring your GP, but you don't need to wait for a test. You should need to self-isolate whilst awaiting instruction from your GP and a test, and you need to follow their instruction very carefully in terms of when it is safe to no longer self-isolate as well. And your GP will be the person who will guide you through that process rather than a duty on your employer. In relation to the Swedish model, look, I think it's in relation to this pandemic that we're all learning more about every day. I think there's a huge effort to draw kind of league tables and compare countries. And look, we do it as well. Everyone does it. It's very hard to do it, though, because I think this pandemic is still going on. In many ways, you're asking a surgeon to come out of the operation halfway through the operation and see how they got on. I think we'll know more about the different responses each country took, hopefully when we're in a post-COVID era. But I've no doubt every government, every group of people, every country, every public health experts will have done their best to protect their people. Which strategy turns out to be the best one, I think only time will tell us.
Thank you very much. Deputy Malcolm Noonan.
Minister, at the outset, and thankfully with the trend going in the right direction, we must be mindful that as of yesterday, 1,659 people lost their lives to Covid-19 in this country. And behind that statistic are many broken hearts and brave families. Once again, I wish to put on record our appreciation of you and your department's work and all who continue to serve on the front line of the pandemic and its wider impact on our health services. Minister, I wish to support your comments made yesterday regarding the demonstrations that took place here in Dublin last weekend. Yes, all of us who uphold the values of respect and inclusiveness abhor the brutal murder of George Floyd and the disgraceful response of the President of the United States at a time when leadership was needed. I appreciate too that people here and around the world wanted to make it known that they were appalled with the Trump regime, but surely there must be another way. A petition on behalf of the Irish people delivered to the American Embassy could have made an impact. We cannot risk the gains we have made, we cannot put our frontline workers at any undue risk, and we cannot put the lives of those over 70 at risk. Like our President, I hate the term cocooning, but our older folk have made immense sacrifices. I have a number of questions for you, Minister. Day services for people with disabilities are waiting on direction from your department and EPID on how to open up their services. Many of the people who avail of these services have been at home since March, living with parents, many elderly, who are struggling to continue with care and have had no respite in that time. Families want these services to reopen, the services want to reopen, but they need guidance and support to do so. Question 2. Minister, can you give a brief overview of the health services available to the traveller community during the COVID pandemic? In particular, has your department ensured that all traveller families have access to traveller primary care nurses and healthcare teams? Is your department aware of the particular challenges faced by traveller families during the pandemic in relation to access to basic services, ability to maintain social distancing, good hand hygiene and access to mental health and peer-led support services? Minister, there are a number of urgent items which I think need to be addressed to support our traveller community, mindful that there has been no increase in spending on traveller primary health care since 2008. Firstly, to publish and implement the National Traveller Health Action Plan as a matter of urgency, including the establishment of the Planning Advisory Board for Traveller Health with dedicated staff and budgets to drive its delivery and implementation. Appointment of senior level official with exclusive responsibility for traveller health within the DOH and HSE to prioritise traveller health needs and to ensure traveller health is mainstreamed within all divisions of policies in the Department of Health within the work of the HSE and supporting the implementation of the National Traveller Health Action Plan. Sláinte Care recommends that access to universal GP care within 5 years. We would recommend that travellers be prioritised and fast-tracked in this process, and that travellers employed in primary healthcare projects are entitled to a medical card. The traveller-specific health infrastructure, including traveller health units and traveller primary healthcare projects, should be protected and receive increased resources for their expansion and development. And finally, a clear budget is allocated and protected to address traveller health inequalities at a national level. Minister, I wish to commend your department for the partnership approach adopted early on during the pandemic with traveller advocacy and development organisations to ensure that information was forthcoming and traveller specific, and for the way in which local authorities responded to the accommodation needs. But my main concern here is that there has been historic underfunding of services leading to poor health outcomes for children and families, and this needs to be an ongoing priority for the next government. Minister, I have heard no discourse at all in relation to COVID about our Roma community in Ireland, and like our traveller community are particularly vulnerable, if not more so due to an absence of any infrastructure to support them. Out of an estimated population of 4,000, 60 have contracted COVID, and sadly there have been 8 deaths. what specific healthcare supports are on the ground to support the Roma community during COVID? Minister, when will the roadmap for opening up of full medical services be made available to the public? There are many patients waiting on services and surgeries which, although elective and possibly non-urgent, would also have a huge impact on quality of life of the patient. I mentioned last week, Minister, the video fluoroscopy services at Temple Street, and thankfully they will be up and running in June, so I do welcome that development and thank you for that. Your department has indicated to my colleague Deputy Smith that this roadmap has been developed. You indicated in the Dáil on the 21st of May that you expected the roadmap to be available within 2 weeks. So I would be grateful if you could inform us of your department's progress in this regard. Clear and effective communication to patients is highlighted as one of the key principles of the roadmap. There is currently no clear and effective communications to patients. And finally, Minister, at the Covid-19 committee on Tuesday, which I attended, and was happy to hear the work that resumed in relation to orthopaedics, rapid access cancer services, and actively growing number of cardiology and stroke attendances. And I understand that private hospitals are being utilised in this respect, and it's good to hear that their capacity has increased to 54%. Could you provide some clarity on the number of patients this relates to? As was outlined in the committee, the aim now is to increase this capacity for the remaining weeks of the deal. Could you clarify how this is to be done and what services will be resumed? Thank you.
Thank you, Deputy Noonan. Minister.
Thanks very much to Deputy Noonan for his questions. And look, I echo his comments in relation to the protest. I think there's an onus. It's easy to criticise a protest when you don't agree with the cause of it, when you don't agree with the reason behind it. It's harder, perhaps, when you do support the cause. But that doesn't mean we can be silent on it. What's happened to George Floyd disgusts and repulses everybody in this country, I believe, and probably all sane-thinking people across the world. But at the same time, any gathering, no worthy the cause, is a danger to public health at the moment, and we have to be conscious of that. And as you say, there are other ways we can make our voice. And I appreciate from your own party that has a proud tradition of protesting and highlighting social issues. I appreciate the call that you're making in that regard as well for people to adhere to public health advice. On the issue of the Disability Day Services, a very good meeting with Inclusion Ireland yesterday, and this was one of the topics that we covered. And I expect this month the HSE will have an update in relation to how they begin to resume those services. I think we might have some encouraging news in relation to maybe children with disabilities as part of moving to phase 2. But in the general issue of reopening day services, a lot of work going on with different organisations. Some of those organisations had their staff helpfully redeployed to assist us in the COVID effort. There's a bit of work to do in that regard. I really appreciate you raising the issue of traveller health. It's been one of my great regrets that we haven't got the Traveller Health Action Plan published yet. And I would urge whoever the next health minister is to get that done and get that done quickly, because it's nearly there. It's a really good piece of work that's been in the making now for quite a period of time. I'll write to you on this, but there has been a lot of measures put in place to assist the travelling community during this pandemic, including regular traveller meetings between the traveller health units and the HSE's social inclusion units. There were 3 times a week initially, now once a week. A national helpline up and running since March, a specific website resource page, extra communications, classifying travellers as a priority group for COVID testing criteria with GPs, a COVID traveller response team, travellers included in specific guidance for vulnerable groups, posters, videos, a digital partner pack on the HSE's website, the primary health care professionals in traveller health continuing to work as well. So I'm satisfied a lot of work has been done, but I'll write to you in detail. Similarly, for the Roma community, HSE has produced specific guidance for preventing and responding to COVID-19 among the Roma community. While the Roma do not live in congregated settings, such as homeless services, they often do reside in overcrowded accommodation in the private rented sector, which can give similar risk to the spread of COVID-19. So again, we've had a national helpline for queries for the Roma community. We've had over 700 calls made to that helpline. We've translated information and booklets and posters into Romanian, into Czech, into Slovak, into Romani. We've had a HSE Roma information video. We've had outreach work in the Roma community in CHO 5, 6, 7, 9 and 8. And again, I'll write to you with more detail in the interest of time on that. On the issue of non-COVID care and where's the non-COVID care plan, a very valid question. I met with the HSE CEO, Chief Operations Officer, Chief Clinical Officer and the Chairman of the HSE yesterday, along with my Secretary General. That plan was to go to the HSE board yesterday evening. And then will be shared with my department. So my understanding is the HSE board was considering that yesterday evening, and I expect the HSE to be in a position to update on that in the coming days. Really good work being done by the HSE in that regard. In relation to how we utilise the private hospital capacity, the HSE has identified a number of additional patients who may be suitable for treatment during the month of June. I think it amounts to over 4,000 additional patients. I'll write to you with some more detail on that, and the NTPF, I think, has identified them.
Deputy Alan Kelly.
Ciaran Corra, Minister, just you need to watch the clock, make sure you don't overstay the 2 hours again this week. Very concerned, because I would have been in close contact according to your logic. Yeah, I'm glad to hear it, honestly. Just in relation to the HSE roadmap, which you spoke about just previously, I have 2 sets of questions, Minister, so I'd appreciate if we could block them into 2 sets of 5. The HSE roadmap, we've been promised this on numerous occasions, so it's late. So will it be published tomorrow? This is singularly the most important thing in Ireland now, without a shadow of a doubt.